Therefore, stay at a healthy weight. This helps prevent excessive stress on the heart. It also lowers health risks linked with surgery or other procedures. Talk with your care team to set realistic goals for body mass index or BMI and weight. Number 5, limit or stay away from alcohol. Sometimes irregular heart rhythms and blocked blood flow are triggered or made worse by alcohol use. Ask your healthcare professional how much alcohol, if any, is safe for you to drink. If you choose to drink alcohol, do so in moderation. For healthy adults, that means up to 1 drink a day for women and up to 2 drinks a day for men. Number 6, control blood pressure and cholesterol. High blood pressure and high cholesterol increase the risk of heart disease. Make lifestyle changes and take medicines as directed to manage high blood pressure or high cholesterol. Get regular health checkups. Your healthcare professional might recommend regular follow-up appointments to check on your condition. Tell your care team if you have new or worsening symptoms. Number 7, practice good sleep habits. Poor sleep may increase the risk of heart disease and other chronic conditions. Adults should aim to get 7 to 9 hours of sleep daily. Again, I repeat, adults should aim to get 7 to 9 hours of sleep daily. Go to bed and wake at the same time every day, including on weekends. If you have trouble sleeping, talk to a healthcare professional about strategies that might help. Now let's talk about coping and support. Connect with friends and family or a support group. You may find that talking about hypertrophic cardiomyopathy with others in similar situations can help. It also is important to control emotional stress. Getting more exercise and practicing mindfulness are ways to ease stress. If you have anxiety or depression, talk to your healthcare team about strategies to help. Preparing for your appointment. You may be referred to a doctor trained in heart disease. This type of care professional is called a cardiologist. Here is some information to help you prepare for your appointment. What you can do. When you make the appointment, ask if you need to follow any restrictions before the checkup. For instance, you may need to change in your activity level or your diet. Make a list of your symptoms and when they began. All medicines, vitamins and supplements you take, including doses. Key medical information including other conditions you have and any family history of heart disease. Question to ask your healthcare professionals. Question to ask your healthcare professionals might include: number 1 question, what's the most likely cause of my symptoms? Question number 2, what test do I need? Question number 3, what treatments can help? Question 4, what risks does my heart condition create? Question 5, how often will I need follow-up appointments? Question 6, do I need to restrict my activities? Question 7, should my children or other first-degree relatives be screened for this condition? And should I meet with a genetic counselor? Question 8, how will other conditions that I have or medicines that I take affect my heart condition? Feel free to ask other questions you have. What to expect from your doctor? Your healthcare professional is likely to ask you questions such as: how severe are your symptoms? Have your symptoms changed over time? If so, how? Does exercise or physical exercise make your symptoms worse? Have you ever fainted? What you can do in the meantime. Before your appointment, ask your family members if any relatives have been diagnosed with hypertrophic cardiomyopathy or have had unexplained sudden death. If exercise makes your symptoms worse, don't do strenuous exercise until you have seen your healthcare professional. Ask for a specific exercise recommendations. So that's all about hypertrophic cardiomyopathy.